Hi, remember the last time you went to a hospital and you saw a small baby smiling to herself, and you were so touched by the innocence of the small soul. But just then, you saw a nurse approaching the baby with a needle. The needle pierced the skin of the baby, and the baby cried and tried to reach out to his mother. And you said to herself, this is for the own benefit of the baby. Did it ever cross your mind? Can I do something that can take the pain away from the baby without compromising the medical benefits? If yes, then we are here for that moment of to cater for that moment of helplessness. Hi, my name is Sumendra Singh, and I'm the founder of CEO of NeoCare. And at NeoCare, we are developing a painless method of disease detection for babies for diseases like anemia, jaundice, and hypoxia. Motherhood is probably the most happy moment for a wannabe mother. But sometimes those moments of happiness are gone when the child is born with diseases like anemia, jaundice, and hypoxia. Did you know that approximately 43% of the babies born are anemic? 60% of the full-term babies and 80% of the preterm babies are born with a condition called hyperbilirubinemia. And 1.4 million child deaths are because of less oxygen content in their body. Now, now the unfortunate part of the story is WHO says that all of these deaths could have been preventable had there been constant monitoring. And when we say constant monitoring, what do we have? This is what we have. We have to take 4 ml of blood from the baby's body for every 4 hours, and the results arrive after 6 hours. So basically, the mitigation of the diseases cannot start before 6 hours. So, as you can understand, it is a very traumatic experience for the babies as well as the parents. The results arrive after a certain delay, and there's a certain laboratory dependence. Basically, you have the hospitals have to maintain costly benchtop equipments and train manpower to carry out these tests. So, what is the need of the hour? The need of the hour is a non-invasive solution which should be painless. The result should be there right away. It should be cost-effective, and there should be preferably no consumables. So we are proudly introducing our product called Samira. Basically, it is a optical device in which we shine a cool white light on the thumbnail blade of the baby, and the retroreflected light from the thumbnail blade goes back to a onboard spectrometer, and the onboard microcontroller carries on the algorithm, and the results are right away. So, in a nutshell, Samira provides painless, instantaneous, and stress-free solution to newborns as well as parents for detection of diseases like anemia, jaundice, and hypoxia. This comes in contrast with conventional methods, and all of this at a very affordable cost. So, time for a short demo. You can see that all you have to do is you have to touch the optical probe at the nail bed of the baby, and the results will be right there right away. It is as simple as that. So, all the doctors have to do is to, as you can see, Dr. Arnav Madhav is basically touching the optical probe, and the results are there on their computer screen behind them. These are the visuals. The acquired data were validated on approximately 1,500 patients, and we found, as you can see, we found excellent correlation with the data. And in the competitive landscape, we could see that Samira outnumbers in features and in accuracy and all other devices that are present in the market. As you might have noticed that there are three components to this project. The first component is the engineering, which includes the hardware and the software, and I take care of all of that. And I have been developing biomedical instruments for 15 years off and on. I have served for various research institutes as a scientist for the last approximately 15 years. The next part is optics and spectroscopy, and then we have Professor Samir Kumar Pal, who is the favorite student of Professor Ahmed Zoel, who got Nobel Prize in 1999, and he has more than 40 patents and more than 400 publications, several awards and accolades. And finally, we have Professor Asim Kumar Malli, who takes care of all the medical related, clinical trial related issues. And he's from Stanford, and he is the favorite student of Professor Vinod Bhutani, whose the Bhutani chart is still probably the gold standard in hyperbilirubinemia detection. So the pairs that the values that we add with our device is, for the pairs, it is painless, it is instant, so we don't have to wait for the next doctor's appointment. It is cheap and it is accurate. For the doctors, it is convenient. They don't have to they don't have to extract the blood. Don't have to make sample preparation and don't have to send it to the central laboratory where there are significant delays for the result arrival. So you don't have to depend on external lab tests. There are no disposables and no waste, and you don't have to be you have to have a trained manpower or a trained scientific personnel to operate this. This can be operated by minimally trained labor. If we look at the product roadmap, on the left hand side, you can see our product, current prototype, and on the right hand side, you see our under development handheld product, which can be communicated, which can be operated using a mobile phone or a standalone, or using the screen, which is, as you can see here in the slide. We could secure investment of approximately $80,000 in two stages via the Accelerate program, and then we have MITAX Accelerate program in collaboration with the Dalhousie University of approximately $90,000. So we could successfully raise $170,000 Canadian dollars as of now. We have ongoing investment opportunities with the organizations, government organizations like IRAP and ECOWA, and we have also ongoing investment possibilities with private investors like EasyRx and Bandhan Bank. And just a quick reminder that we are looking at a significant market opportunity, and it is approximately, if we assume that 3.6 million babies are born in the US per year, which means 24 million tests are going on. And if we charge around $7.5 in contrast to $15, what is normally charged conventionally, so the total market size is 181 million, and the obtainable share approximately is 50 million. So we are looking at a global market opportunity as 151 million. So as I said, it is a significant market opportunity. Uh, just to say that we have an additional product which is under development right now, under clinical trials right now, which is the urinary bladder cancer detection from unprocessed urine samples. So all you have to do is to collect urine samples and place it, and the vapor rising from the urine samples contains certain volatile organic compounds which interact with the sensors that we have developed, and this instrument is able to detect whether that person has urinary bladder cancer or not. So once again, our findings were published in a very reputed journal, and we have filed the PCT as well. That's all for today. Thank you very much for your patience listening.